This is Johnny Bluestar. I assist Dr. Hugo Rodier, an MD, who is host of the Integrative Hermetic Health Show. In today's show, we will not only be talking about one of our general themes, the reform of the healthcare system in America, but we will present the ideas of an emerging politician who is expressing some very worthwhile policies. Although the choices for president are far from over for all of us, the one winner so far is the understanding of what needs to be done to the healthcare system in the United States is Marianne Williamson. She consciously has been advocating the same kind of system which Dr. Rodier and I have been talking about since we started the show.
First of all, we're the richest country in the world. When you look at how much money people have to pay annually on health care costs, as soon as that is removed, as soon as that sigh of relief can be had, look how much more money that person, every person, has in their pocket that they will be spending that will increase the consumer base, increase job creation, and increase tax base. That's number one. Number two, I'm very aware that we don't really have a healthcare system. We have a sickness care system. Mm-hmm. Western medicine is extremely good at acute care once someone is sick. So what I want to do is address the fact that we have so many chronic diseases that people shouldn't even be getting. So that has to do with environmental policies, chemical policies, agribusiness policy, food policy. I want this country to be healthier, would address it on so many issues. Actually, we'd have fewer sick people.
So does that mean taxes go up?
Well, it's not about taxes going up. Let's talk for a moment. We had a 2017 tax bill. $2 trillion. 83 cents of every dollar went to the very, very richest and the very wealthiest corporations. What you do immediately, what I would do, is repeal that tax cut. I'd put back in the middle class taxes, however. I mean, the middle class tax cut, because I think that was a good idea. But we need to stop giving all the money to people who should never have been given all this money to begin with, because they already have a lot. $26 billion, I heard Jay Inslee mention that as well. I talk about that all the time. $27 billion in corporate subsidies to fossil fuel companies.
Marianne Williamson appeared recently on the Jimmy Dore Show, again to articulate her vision for healthcare in America. In the full interview, you note her openness in discussing various options reflecting on the economic structure of the proposals. But here she is very clear about what she is demanding from the content.
We have to also face the fact we don't really have a health care system in the United States. We have a sickness care system in the United States. Western medicine is very good at addressing acute sickness. We need to address why it is that so many people are sick in America to begin with, particularly with chronic illness. Right now, we just say, once you get sick, then we're having the argument how you're going to pay for trying to heal it. We need to deal with the fact that life expectancy is down because there are so many factors in our environmental policies, our food policies, our chemical policies, our agricultural policies that contribute to making people sick to begin with. So I want to have a health care conversation that goes way beyond the narrow sickness care conversation that we have right now.
So I heard a couple different things in there. So are you for the Bernie Sanders proposal for Medicare for all?
Well, if I know, I don't want to actually say yes because I don't know the exact every single detail. I want a Medicare for all type system where every single human being in this country is totally covered. I want that to be in addition to keeping the Obama exchanges that are there now. And I don't see anything wrong with making private health insurance available to people who want it.
As we discuss Marianne Williamson's vision in the show, it is clear to us, as it has been for a long time, fixing the financial aspect of healthcare in the United States, although it has some benefits, is far from changing the dangerous and often deadly consequences of not recognizing its inadequacy. This is, as Marianne says, due to the soulless profit-making motivation that has corrupted our health options today in, as she points out, the richest country in the world. Also, Join us in our discussion today of this remarkable visionary who's entered into a presidential race that has generally yielded very little positive transformative power to a country which has now been brought by the seat of quite a number of administrations to the brink of authoritarianism and, sadly, massive corruption.